Welcome to the Caladrius Health Channel. When we talk about India's digital health revolution, it's easy to think of it as just one single program. But really, it's much more than that. It's a sophisticated, multi-layered architecture, and to truly grasp its power, you have to understand how these different layers work together. So that's exactly what we're going to break down today.
All right, here's how we'll walk through it. We'll start with the big picture of the architecture, then we'll dive into the foundational registry layer and the operational gateway layer. After that, we'll get into why this structure is such a game changer, how it's governed, and what it all means for the future of healthcare.
So the Ayushman Bharat Digital Mission, or ABDM, the best way to picture it is as a set of interconnected building blocks. The National Health Authority actually gives us a really neat framework for this. They call it a trinity of registries and a trinity of gateways. Just think of it as two distinct layers, each with three core parts, all designed to work together perfectly.
Let's start at the very bottom with the foundation, the registry layer. Its job is simple, but it is absolutely critical. It's all about establishing a single, verifiable source of truth for identity. Because without a reliable way to know who is who, the whole digital ecosystem would just fall apart.
This layer is made of three key registries that all talk to each other. First up, you have the Ayushman Bharat Health Account, or ABHA, which identifies the patient. Then there's the Healthcare Professionals Registry, the HPR, which verifies the doctor. And finally, the Health Facility Registry, or HFR, which confirms the identity of the hospital or the clinic. See how that works? Together, they create this trusted triangle of identity: patient, provider, and facility for every single interaction.
Okay, so moving one level up this stack, we get to the gateway layer. Now, if the registries figured out who everyone is, the gateways are all about how they interact. This is the layer that enables the secure, smooth flow of information, services, and, of course, payments between all those verified identities.
And just like the registries, this layer also has its own trinity. First, the Health Information Exchange and Consent Manager, or HIE-CM, which, as the name suggests, manages the flow of clinical data. Then you have the Unified Health Interface, or UHI, which handles the discovery and booking of health services. And finally, there's NHCX, which standardizes the flow of financial data. These three together, they form the operational backbone of the entire ecosystem.
And let's be super clear on this. The role of NHCX within this gateway layer is strictly financial. It's designed to be the standardized pipeline for all insurance claims, creating a common language that both payers and providers can understand and use.
And finally, sitting right on top of everything, you have the intelligence layer. This is where the system really starts to generate value from all that data it's collecting, powering things like fraud analytics, monitoring how well policies are working, and managing grievances. But here's the key takeaway. The quality of this intelligence completely depends on the quality of the data coming from the layers below. You put clean, structured data in, you get powerful insights out.
So why go to all this trouble? What's the ultimate point of this sophisticated architecture? Well, it's designed to solve one of the biggest, most stubborn challenges in Indian healthcare: fragmentation. It's built to connect what used to be countless islands of information into one cohesive continent.
This slide really says it all, doesn't it? It shows the fundamental shift. Before, you had clinical records over here and insurance claims way over there, in totally separate, siloed worlds. It created so much friction. But this new architecture bridges that gap by creating a unified flow where clinical and financial data are linked. With that financial piece powered by protocols like NHCX, the whole system becomes traceable from start to finish.
Now, an architecture this ambitious, well, it's not going to work without very clear governance. You need rules of the road. And this regulatory landscape is what provides them, making sure every participant is aligned and that the whole system operates on a foundation of trust and compliance.
So who's in charge? The governance framework has a few key players. The National Health Authority, the NHA, is the main steward and operator. Then you have IRDAI, which regulates the insurers and TPAs who participate. And the government, for now, is playing the role of an ecosystem builder, mainly using incentives to encourage voluntary adoption instead of forcing it with mandates. But let's be honest, the direction this is all heading is very, very clear.
As we look ahead, it is so important to see this for what it truly is. This isn't just about digitizing a few old, clunky processes. No, this is about a fundamental restructuring of how the entire healthcare ecosystem is going to operate.
This quote just nails it. The goal is a system where everything is interoperable and traceable. Those are the magic words.
When financial flows become just as easy to track and verify as clinical data, you suddenly create this high-trust, low-friction environment, and that's the foundation for a system that can finally serve everybody: patients, providers, insurers, regulators, all from a single unified data infrastructure.
And make no mistake about it, this architecture isn't some abstract concept for the future. It is being built and scaled right now, as we speak. So that leaves one really critical question for every single organization in the healthcare ecosystem. When this system matures, where do you want to be? Where will you fit in?